Thank you very much. It's very difficult to come after the great announcement that has just been done. However, good morning to everyone, and Good morning to everyone. And after listening to Dr. Janine Furch, we will change the world stage, and for one which is more closer to home. We are here today to explore the critical role of public initiatives in advancing healthcare innovation solutions, specifically tailored to children. As we know, pediatric healthcare presents unique challenges, from the lack of commercial incentives for drug, medical development, financial sustainability, and all the way to the complexities of addressing rare diseases. Public initiatives play a pivotal role in bridging these gaps, fostering innovation, fostering collaboration, but above all, in the adoption of these innovations by the public healthcare system. This session tries and will attempt to address pressing questions such as how are public programs transforming healthcare innovation, and especially in pediatrics? How can we ensure that these innovations are scalable and accessible? And then finally, how can we assure that these disruptive and innovative ideas are finally actually adopted by the healthcare system? And for this, we are fortunate enough to have two panelists here with us today whose expertise and leadership are shaping innovation, both at Spanish, local, and international level. And for this, on my left, we have Lluís Blanch, who is a critical care consultant at Parc Taulí, former director of the Research and Innovation Institute Parc Taulí, member of the Catalan Council for Research and Innovation. But above all, right now, Dr. Blanch is instrumental in coordinating the platform for dynamization and innovation of industrial capacities of the national healthcare system, otherwise known as ITEMAS, which was easier to say, and is thus a key driver in accelerating healthcare innovation projects across Spain. So thank you very much for being here with us. And then further on my left, we have Dr. Robert Fabregat. He was Director General for Research and Innovation in Health for the Catalan Ministry between 2019 and 2021, head of the Cabinet of the Minister from 2018 to 2019. And since 2021, he is Biocat Chief Executive Officer, with extensive experience managing national and international biomedical projects. He has been a key figure in fostering collaborations that transform research from research into impactful, helpful healthcare solutions. And so together, I can say that they bring unique perspectives, very different yet complementary, on how public initiatives can foster groundbreaking pediatric innovations and ensure real-world implementation. So let's dive into the discussion. To start, I'd like to invite each panelist to share their thoughts on the current landscape of public initiatives. So Lluís, if you want to break the ice, and from your point of view as coordinator of ITEMAS, which is a national collaborative platform at Spanish level, how is the promotion and adoption of innovation being driven?
Thank you very much to be at this event that I believe is really great. And what I've seen before, I believe is a really good initiative that I will talk with you now, because we need to implement this in ITEMAS for sure, you know what I mean? Because this needs to be extended for the purpose of what innovation is. So, I mean, ITEMAS was born, in fact, in 2010, and bring the word innovation to the health field, where none of us, not none, but was a little bit unknown the meaning of that word. ITEMAS has been evolving, and since 2020, there is a new definition. It's to promote innovation of those, I mean, discoveries or products or whatever that needs to be industrialized in Spain. So it adds the concept of tech transfer up to a point arriving to the market. And this is what ITEMAS does. Another issue is adoption. Adoption is more difficult, okay? So now ITEMAS is formed on I mean, there is a public call, then the institutions apply, and now there are 26 institutions, and I congratulate Sant Joan de Déu, because Sant Joan de Déu is there with your organization, which in fact was a need, you know, for the platform, you know. And then they work on other hospitals, small hospitals, that they are called associate. Associate means that they get the same benefits being at ITEMAS, but simply that may work together with one of the 26 funded institutions there. Why that? Because innovation must be, absolutely wide and transversal across the Spain geography. Any hospital can think on an innovation project. For example, Dr. Afur showed us something that can be born in a small hospital where they had this type of problems. Maybe not the exhale, but maybe, what you see to facilitate labor, for example. So, in these hospitals, we need to help them in order to catch all these innovative projects and then, trying to accelerate them through a program that I will describe later on, and for anything related to the innovation process, mostly related with the business developers that, is the most difficult part of the innovation. That's what ITEMAS is. So it's a kind of, we call a word which, I don't know in English, but this thing is the same, is evangelization, it's the same, okay? Because we need to introduce the concept of innovation everywhere.
Perfect. Just to further clarify a point, I understand that ITEMAS is basically public institutions, from my knowledge. However, is there a line where you collaborate with publicly through the ITEMAS, with private institutions through the ITEMAS network? Is there collaboration private-public?
Well, you touch a hot point. Okay, so ITEMAS, it's a public institution, but one of our goals is co-create. Co-create is public, private, through a tech transfer, get an innovation product. That's why, private institutions must be there. So we need, we have certain rules to collaborate with private institutions, but still there is a lot of work to do. We need to understand that here in Spain, that maybe we need to be like United States, where private-public collaboration is a need that all the society, all the administration understands, because it's something which is key for the future of the country, okay? And this still we need some work to do in Spain. So ITEMAS, it's born in the Ministry of Science at the Instituto de Salud Carlos III, and it's completely public, but we must work with the private. So we need to have the frame for that, and we are we are working on that.
Perfect. And we can leave for later. I think public-private collaboration is key, and we will discuss later also the roles that families and the society plays in driving innovation and how societies can contact with the public and private, but we can discuss this later. So now, Robert, if we now focus on a more regional level, I have often heard that Catalonia is a reference for an innovation ecosystem, no? How does this complement the national scenario, the Spanish scenery, and what conditions exist here that possibilitate this consolidation of this innovative ecosystem here in Catalonia, if you believe that this is so, no? If we are an example of a prospering and high-level ecosystem.
Yes, as you say, nowadays we can say that the bioregion of Catalonia is one of the most innovative ecosystems in Europe, no? And this is a result of the nice work that all of us have done during the last 20 years, no? I think that the main tool that we have is the creation of networks and synergies. And when we speak especially on pediatrics innovation, this is mandatory, because at the end, you know all the barriers that you have now when you want to develop this kind of innovation, but one of the most important barriers is the financial support, because at the end, children is a smaller market for the economical return for the big companies is not secure. So we need this kind of public-private collaborations, because if not, most of the initiatives come exclusively from the public part. No? So as we have here in the bioregion, we have all connected, the startups, the spin-offs, the hospitals, resource centers, also the investors. This makes this kind of environment that make, I think, easier the development of innovation in general, but specifically in pediatrics. If we see in the bioregion, we have around 20 companies that are only focused in pediatrics innovation. 5 of them are focused on rare diseases, but we have nice. Always there are few than we need, no? But we have nice success stories. You mentioned, for example, not example of this impact for kids, but Biocat and Sant Joan, that they work together in the health program, no? That allow us to identify needs that we have, but also trying to create, no? At further early stages the solutions. But you will further talk later about the Montana Invest Fund. We had just 4 or 5 years ago the Marathon Foundation, no, that achieved or raised, no, the second highest amount of money. You have specifically initiatives such as Unicas, no, for example. And I think that from the point of view of Biocat, we always defend that if we want to arrive and to make faster arrival of innovation to the healthcare systems, we need to connect. We need to work together, the public, both public and private. Why? Because at the end, the public sector knows the needs they have. Not only the clinicals, also, as you say, the patients, no, the families, no? But we need to go further to this oriented innovation, no? We need to know the needs, those know that we have to push more and to to push with much more power there, and then to connect, because at the end the developers of this innovation need to receive this kind of messages. No, I will explain later what we are trying to do with the PASS, the program that wants to accelerate the adoption of this innovation. But I think that in global we have different pieces, but at the end is the network of connections of all the agents.
I think you've touched on some very important key points. When we speak about public initiatives, we find that pediatric innovation is largely underfunded, and when even you could assume that any financing of any public financing could support both pediatric and adult innovation. However, when, like you say, when you look at the statistics, you analyze investment, number of projects, spin-offs, solutions, devices, drugs, etc. They're often much less in number, And as you say, I think that pediatric healthcare has some unique challenges. It's a small niche. Obviously, it has to be scientifically and clinically sound, viable, ethically responsible. But I imagine that there's also this part of tailoring, and the personalization that needs to go into pediatric innovation that isn't always there and can be more generic at adult level. These complexities, highlight the critical importance of dedicated public and private initiatives. And since we're here on a public, how can, and I think you've already sort of introduced a lot of these aspects, how can we leverage these networks, both at Spanish level and then at regional level, to drive innovation specifically for pediatrics, without having maybe to, singularize them, having to bring out calls or finance specifically? How can we close this gap between what the public initiatives can bring and as you said, there are a lot of companies, there are a lot of startups that are already working in pediatrics. How can we use your networks to bridge this gap between these two areas, these two sectors?
Who starts?
Whichever one. You can start.
Okay, thank you. I mean, what you said is very important. So just some figures. We accelerate projects in ITEMAS. From 102 projects, there are only 4 that they are pediatrics. I mean, these 4 pediatric projects, 3 are medical devices, 1 is drug discovery. So these figures do not, I believe, reflect the reality of the country, where, I mean, pediatrics as a health system, it's in the top countries in the world. So there is a dissociation there. Why that? Well, I don't know. Probably we are talking here the whole day how to solve that. But in ITEMAS, I was speaking with her now, what we can do. You need more associate centers, and we need to promote to work with more people. Because probably if there are some, I mean, innovations are everywhere, in processes, in services, I mean, in management or whatever. But the innovations that we would like to be transferred to the market and be adopted for the hospitals, I mean, these need some pushing. And this needs to be done through institutions like ITEMAS, associated hospitals to Sant Joan de Déu, and also internationalization. Sant Joan de Déu, I mean, leads the internationalization, I mean, of innovation in Spain, where, I mean, pediatrics must have certainly a role. And then, I mean, then we need the public-private collaboration, and in diseases where, I mean, there is less private investment or whatsoever, we need to convince the governments that this is essential for the society. So they need to, I mean, to put money there, because if not, I mean, there will not be investment for rare diseases, or you know a lot on that. So that's the message. So we need to push all of us in the same direction. For example, at ITEMAS, talking with people, convincing people that innovation is important. We need to talk with the headquarters and the general managers of the institutions, because simply sometimes they believe that, I mean, this is not their problem. So we need to insist, and at the end, we need to change the administration, which will be the more difficult.
I think that in pediatrics, you concentrate all the difficulties that in general the innovators have, no? Because at the end, a smaller market, it doesn't appear on the medias, it's more difficult, there are clinical difficulties, there are also regulatory challenges, no, to solve, so you concentrate all of them, no, all these difficulties. For that reason, it's not easy. I think that, as I said before, this cannot be only managed by the public sector, because at the end, the money and the funding that comes from the public administration is limited. So we need to convince and to and to attract, no, the private collaborations, not only investors but also big companies, no, corporates, etc. No, and to do that, as I said, I think that we need to connect the needs with the developers of the innovation. No. Normally, when you are here working in the hospital Sant Joan de Déu, you see every day the difficulties, the diseases that children have, but there are a lot of technological developers that not only do not know about the needs that you have in pediatrics, but most of them come from other sectors, different, no? They start to develop their technologies, innovation, thinking about how to solve those that they see every day, no? But there are sometimes that they do not know these needs. So what we are trying to highlight is, okay, we have our public healthcare systems, they need to put, to show which are the priorities they have, no? And then trying to make possible this connection and to make the orientation from the very beginning. Because normally in the past, we start these connections at the end of the pathway. And when you are in a TRL that is 7, 8, 9, you cannot change the work that you did during the last 4, 6, or 8 years. So we are trying out with this program in Catalonia that this is a big difference in comparison with the rest of regions in Spain, but also in Europe. No, we are trying to connect from the very beginning the user, the final user, and I speak not only about market, because I always say that we need to ensure the access to the patients, because there are some innovation that arrives to the market, but not to the patients. That it means the adoption from the point of view of the healthcare systems. But we need to connect from the very beginning of the development of the innovation, at the early stages, the developers with the final users. And this is something that I think in pediatrics is specifically a must to solve. Yeah.
I mean, I think you've probably hit on the key there. I think mainly a lot of the times, because when the market can have ideas, but then sometimes when they reach the actual user, the patient, you realize that, well, maybe I should have made this differently. Maybe I should have, there's no actual connection. So how can you then connect this, the patient, the actual needs, when we talk about needs, not the market, but the actual patient, the final user, and the market and the public sector? How do you do that then? I mean, because I understand that the public sector, they have initiatives, you have the market that can, they can respond to those initiatives, but then the end user, how do you put the end user into the equation? how can public institutions, how can the Catalan government, how can networks like ITEMAS include the patient to make sure that those innovations actually respond to their actual needs? And then my second question would be,
Luisa, you raise an important point.
let me just add one small, so that you can also expand your question. Not only how do we put the patient into the equation, but then how do we talk a lot about collaboration throughout the network, no? But the needs of maybe some patients in Barcelona have nothing to do with the needs in Extremadura or in Galicia or in Murcia. How then can this collaboration help also to make sure that the health system adopt solutions which can impact different types of cohorts of patients? Because, I know, I think from my colleagues in I4Kids who are extrapolating all our projects to Europe, the needs of children in pediatrics, let's say in the north of Europe, don't have to be the same as the one here. And sometimes when we collaborate in projects and we develop innovative solutions or projects, not only are the public, the bureaucracy different, the legal issues, regulatory issues are different, but also the patient needs are different. Our culture has nothing to do with the Northern European culture, for example. And within Spain, we find these differences as well. So this double vision, not only how to include the patient, but how can we go beyond the differences when we collaborate in order to assure that, we are actually responding to those needs.
Okay, now the question is even more difficult, okay? So, Luisa, you raise a fundamental question. Patients must be there. We have Patients Association, not pediatric, but Patients Association in our innovation committee. We have a huge innovation committee with all actors that any project that we want to accelerate, the last to opinate is the innovation project, where the patients are there. But this is not what you are talking about, okay? Yeah. So patients are there and they say, well, but this is really good and this will be accepted and is needed. Then how to work on that? I believe that sometimes what we face in ITEMAS is companies that they arrive and they present their product. We have, this is a product that it will be very useful for patients, pediatrics or adult. So, but it's not something that the clinicians have asked for, okay? So this is the first thing to do. We need to connect the needs or the problems or whatever of the, in the health world, adult and pediatric, to the companies and then to find solutions. This is difficult, not in the opposite way. If we do that, then we can, work together. If we have the appropriate regulatory, which needs to be not complicated and not further complicated, because it seems each one that appears new, it's more complicated than the last one. We need a regulatory that can help these type of projects. And then we will have, at least from the needs from the medical community, the industry can solve. And here, the patient is a part of this equation. And we need, I don't know how, through living labs or whatever, you know what I mean, any initiative, but the patient must be there, because not only saying, this is good, but also for, fundraising or, collaboration, whatever, So, but we need definitely to work on that.
I can explain the Catalan experience that we are developing since 2 years ago, no? That is this program for the adoption of innovation. When we started that, the problem was that, okay, those that are creating the innovation think that the innovation is the best in the world and will arrive, and when they arrive at the end, after having wasted a lot of years, they arrive and the healthcare system says, I don't need that, or this do not give me the impact that I need to make it easier, the adoption of this innovation. But from the other side, from the healthcare system, they also have a big problem, because they say, I have a lot of needs, specifically needs, and the market cannot give me the solutions, no? So from the side of Biocat, we are trying to identify all this innovation, all those innovators, trying to help them to accelerate these technologies. But from the side of the Catalan healthcare system, what they are developing, and I think that they will present in a couple of months, is to have a transparent methodology to explain to the population which are the needs that they have in order to orient them, no? But the most important thing, as you said, Lluís, is that they are selecting and identifying these needs not only from the view of the Ministry of Health, they are doing this together with the providers, healthcare providers, but also with the patients and the associations of patients. And what they will do is, okay, every 1 year, 2 years, 3 years, there will be different kind of needs, no? Because there will be mid or long-term needs and other that it will shorter, but they will show this. I think that this will be very useful for this kind of needs, because they will show that there are some specific needs for children, that children are not only younger adults, because there are some innovations that can be adapted, but they are not easy, and there are a lot of innovations that are totally different for adults, no? And these kind of messages, I think that need to be very clear, because the audience that are here, you are experts in this field, but for the rest of the world, it's not easy, and we need also not to highlight this kind of differences, no, in order to make understandable that from the early stages, you need to focus these innovations to children. If not, it will be too late, no? And we are trying to do that, and I think that is very important, the voice of the patients, because and the families, not only from the healthcare systems.
And I think Dr. Furch mentioned slightly at the end of one of the questions, not only is this voice important, no, but also I think the idea that public institutions see pediatric innovation as a long-term investment. At the end of the day, a lot of the investments, a lot of the innovation that goes on in pediatrics, not all of it has to be product, or a lot of it is also related to how adding value, to treatments for patients, etc., not only related to product. And a lot of this, the long-term return will be, in the long term, what is needed for public institutions, public initiatives to go beyond the short-term period, to go and see that investing now in pediatrics is helping the system in the long run. Because a lot of the time when we think of public investment, we think, well, a lot of them are politicians who make the decisions, and their view is only as long as their public term. So how do we go beyond that? What do you think is the way for public initiatives to go beyond that, for it to be in the long term as a challenge? I see this as a challenge for the future. How do you think, personally, we could go beyond this short-term view?
Okay.
This is a more difficult question than the previous one, I think.
Well, what we need, is to convince the society that what we are doing, we means...
all of us.
I'm the system.
Yes, okay?
Yes. This is important in that way for the society. To have, for the health system that we have, which is really good, because it is sustainable, because it is green economy. We need to present all this, and then, more important, this will be adopted by all the hospitals in our geography, and this is absolutely, nowadays, impossible. We have 17 autonomous communities, each one has their own administration and whatever, but we need to do that. When we have something that works here, why is not adopted immediately by another community? This is, and now, in my view, is where the patient, it's important, because patient associations or pediatric or whatever, they look, there is something there, and we need, this to be adopted here. And the politicians are sensitive when the patients demand something. Look at what happened at Spain with the ELA and you can translate better than me. Okay, so then we need the patients to be involved in asking. This is the need that we as patients, as citizens, must be done.
And I will come down to you, Robert. As we mentioned, a big percentage of pediatric innovation is related to rare diseases. And as Dr. Comella mentioned before, 95% of rare diseases have no treatment. 50% of them aren't diagnosed. A lot of them are very often misdiagnosed. Some of the challenges for the future in pediatric innovation is very much closely linked to therapies and to finding these treatments and curing as many as possible. One of the let's say the main issues that is in vogue at the moment are all the integration of advanced therapies and emerging therapies in this pediatric sector. I know that Catalonia has been very active, and so what is the future of this sector in pediatric innovation?
I think that the answer is related a bit with your previous question. At the end, we need to make and to ensure the sustainability of our public healthcare systems, and this is not easy. And this needs to think on long-term planning, because at the end, the money that we put in the healthcare system is not an expense, it's an investment. But this is not easy for politicians because they have a lot of short-term needs. Normally there are a lot of change. So this is the first thing that we need to change. And when we speak specifically on advanced therapies, it's more or less the same. Nowadays, these advanced therapies are very expensive. When they arrive to the healthcare system, they say, I cannot pay that because in addition, the evidence is not as clear. We need to create different kind of connections and collaborations. So in advanced therapies, in Catalonia, we have a lot of agents that are doing a very good research, and they are starting to transfer, and we have some success stories that arrived to the end, such as, for example, the CAR-Ts from clinic. We have local initiatives such as your platform of ATMPs here, but we also saw how Catalonia received the 70% of the funding from the Certera consortium, promoted by the ICI, from the Spanish government, and we created a couple. It was 1 year ago, but it started before summer, the ATMPs network in Catalonia, where we have not only the hospitals, research centers, but also startups, spin-offs, corporate investors, because at the end, we have more or less the same kind of challenge. We have challenge in terms of how to scale up these initiatives, and we need infrastructures. We also need talent, a specific knowledge from our professionals. We need to create new ways of collaborations, because at the end, we will need these public-private collaborations to make this possible. If not, it will happen the same as in other fields. And we also need to create new ways of reimbursement, and also to accept the risk of adopt this innovation. Because at the end, I understand both views. When a company make possible the arrival of these therapies to the market, they say, okay, I invest a lot of money during 10, 15 years, and I need to have a return. But when from the side of the healthcare system, they say, okay, but this is very expensive. I know these solutions, these therapies give us solutions to my patients, but it's too expensive, and it's not as clear the evidence, because are different kind of therapies. So we need to create these collaborations in which the risk maybe should be shared, and thinking on how these solutions will give the results that we expect after 10 years. So I think that we need to create a different environment of collaboration. If not, and we are trying to do this from the side, from the view of Catalonia. In fact, Catalonia is also leading a regional innovation valley in Europe in personalized medicine, focusing advanced therapies and data, because we are trying to lead these kind of connections in Europe, but from the regional point of view. I was last week in Brussels, invited by FP and also the European Regional Alliance on Health, and we could see how the view from the regional ecosystems can complement the view from the states, because at the end, the regional administrations are closer to patients and to the healthcare systems. So there is a view that is more strategic, maybe, that is discussed in the commission and from the view of the states. But now we need to complement with the view and the difficulties that we have at regional, local level, because we can understand better, no, the problems that the healthcare systems have, or the needs that the patients have.
You want to? I've seen you nodding, Lluís. Do you want to?
I was in the hub meeting of advanced therapies, and how many people were there, Robert?
Nowadays there are more than 50 institutions, 55 institutions.
In Catalonia.
In Catalonia.
That means that if there is enough, investment on that, then I'm not expert on that, and excuse me if but we go to the exemption, the hospital exemptions for this type of drugs. So that means that maybe we do not need to pay for some drugs. Yeah. Okay, and this is regulated in Europe, I think. So we need investment in that.
I think summarizing a bit what you're saying, no, at the end of the day, it seems like what we need is like almost a new contract, no, between all the different actors. What was in place, let's say 10, 15 years ago, isn't the situation now, no? We need like a new sort of contract between all of us where impact is important, where innovation is important, no? Where new financing schemes are put in place, no? When we look beyond the short term towards the long term. But, and just to sum up, because I'm being told that we have 2 or 3 minutes left, I think we've seen a bit positive, negative, but I think, and coining our phrase of science for hope, I'd like to say that there is, we have innovation for hope for the future, no, that the future isn't as dark as it seems. So one phrase from each of you, if you could, a hope for the next 5-10 years, what would it be? Based on how we can bring about this new contract between all the actors to help innovation in pediatrics.
All right.
One phrase.
To be a little bit provocative, we need innovation industrialized in Spain, because I work for the Ministry of Science, industrialized in Spain, to get funds for institutions, for more research, for rare diseases, for people, and then the country will grow to sustain this health system that I'm very proud, because it's really good.
Perfect.
I think that we cannot accept having future solutions and that these solutions will not arrive to patients, as we cannot accept that. Although there are a lot of difficulties and barriers, this will not be a nice to have, it will be a must. And I'm sure that this is the reason, because the paradigms are changing and these kind of connections are increasing, and this did not happen in the past. So I think it will happen, unless, although it's difficult, but we will continue working. And so
we're on track for a brighter future then. I don't know if we have time for any questions, maybe a couple of questions from the floor.
Come on, Doctor Comella, here again.
Maybe I should not talk too much, but you were so provocative and so inspiring and so nice roundtable. Let me share with you some additional things or feelings. I don't know. First, we always say that this is a small market. That's not true. 6 to 5% of people has rare diseases, and of those, 50 to 75% of them are children. So what means that individual diseases are rare, but collectively, no. So what we need to transmit is that there are common needs for uncommon conditions. For example, technology. Technology could be applied for many of these different rare diseases. So it's not so uncommon, not so rare. So, but if we ourselves say that this is a small market because these are rare diseases, we are throwing, piedras, stones on our, So that's one thing. Maybe, I hope you agree with me. Okay, so second thing, Very important for me. I mean, we here in Catalonia think we are kind of island on that, but Europe is losing the pace. I mean, when you see where the new therapies are generated, those are in the States and in China. So, and we are losing that pace. So, also to be provocative, if you don't produce, we'll buy. And that's the point. And if you think that education is expensive, try ignorance. It's even more expensive, right? So I think we have a problems to produce those drugs, those living drugs that are expensive. Why? Because I think the reimbursement for the companies should be changed. I mean, there is a new deal on that. I mean, the third generation therapeutics, to me, is no longer valid what we have done for chemicals or for immunotherapeutics. You know, and I don't have the answer. But what is a drama is that we have gene therapy approved and working at 2 million, and the pharma company decides not to continue those treatments because they are not able to be adopted by the public system. That's a drama, because there are people behind that. Of course, I mean, there is always a balance. If you finance that, you're skipping, I don't know, malaria in Africa. Okay, we should not compare. There will be tracks for any of those things, to me. And for me, that's the most important thing. We should think on new ways to deal with that. I mean, shared risk, that's an important thing. Impact. What means that we spend such a lot of money enhancing 1 month at the end of the life. The new drug that has been approved on Alzheimer, I'm working in Alzheimer as a background. This will not work. I can assure you, the hypothesis is wrong. But we will approve that at 20,000 euros per year, per patient. I'm sorry. I mean, pharma is pushing, and it's his work to push. Mm-hmm. But we should be more, I mean, how to say? I mean, we're more stringent on HTA, on approvals, not in regulation. Regulation, we have enough regulation. But try to really assess the impact for the populations, you know? So, I mean, there is no question, there's an opinion, but if you want to share your thoughts, I will be happy.
I would like to just very short. I totally agree on the third part, as you said. I think that we need to change the paradigm. These therapies are not like drugs, no, normal drugs. I'm chemist, I'm organic chemist, and I need, but not only the models of reimbursement. I totally agree that we need these risk-share models and to put the focus on the impact, no, at mid and long term. And we also need to change the regulation, I think. But totally agree in this third part. About the second, also totally agree. This is not only a local challenge, it's a global challenge. This is the reason because we try from Catalonia to be around the tables where these challenges are discussed at the European level, because if not, the problem will be at the European level, not only here, but we are trying to do things from here because we have the knowledge and we have the capacities and the agents that I always say that we can be proactive in this field now because the train, we can be leading the train and not as normal here in Catalonia. Normally we are at the end. And about the first, when you said about the market, I agree that this is not a small market, for sure, the figures are there. I was saying about the awareness that people have. Because I don't want to open a debate, but I think that you also agree that women are not a small market and how innovation is focused on women needs and on the women healthcare. So I think that the innovation has been developed to focus in men and adult men. So we need to change these things, and this means that we need to rise and to highlight the awareness about pediatric specific needs. So And these kind of figures and numbers you say, we need to share with the rest of the ecosystem, yeah. So.
We need more innovation pediatric days like today to raise awareness and, no?
Regarding Europe, the Draghi Inform is exactly like this. I mean, if we do not do deep technology, innovation, and changing also the policy makers and all that, I mean, then we are done.
Time for one question more, and we're going to sum up this roundtable. Thank you. Could you please introduce yourself? Thank you.
Thank you very much for the nice table. So I'm Yolanda Jordan. I work in Sant Joan de Déu Hospital Pediatric Intensive Care Unit. Maybe my question will be a little controversial, but what do you think about maybe the possibility to regulate or even to legislate about the proportion on pediatric innovation projects from both public and private companies? I mean, similar that it happens with clinical trials. And in this moment when there was a regulation about how many proportion of pediatric developments will be done, the number of clinical trials dramatically increased. So maybe it could be the final push for this increase in innovation in pediatrics.
Thank you.
If I correctly understood about the proportionality on pediatric and the rest of the trials, I mean, it makes sense. It's an issue. I mean, to focus on the importance on pediatrics and also to have a more. I mean, you have a network, but your network is not enough. I mean, there are a lot of pediatrics. I work for Spain that they are not there. Once they are there, I mean, then I think this can be done. The problem with clinical trials is that most of them, they are financed by the big companies. And I don't know if certain trials will be financed by the big companies.
I think I do not have the answer, but I say maybe, because unluckily, right things not always happen spontaneously, and the inequality between men and women is an example. We need to regulate and to create quotas, to ensure that maybe we should do something like this, to ensure that there is a more or less a proportion focused on the needs on pediatrics if these do not happen spontaneously by the ecosystem. So I check this into, we will explore this.
Or to extend all the innovation also to pediatrics and not focus only to adults.
Yeah.
This is something that can be in the checklist. In the checklist now we have is this green, gender, so this could be extended to pediatrics. That's a nice point. So I will raise this to the Charles III Institute.
Okay, things to do, this checklist. So we're supposed to be at the equator of this day. Yes, so please,
Thank you very much.
a big welcome. Thank you, Luisa, for this moderation. Thank you, Robert Fabregat and Lluís Blanch.